That shit scares me. That is the stuff that truly scares me. So now I'm scared. I'm getting stressed out. I'm so stressed. Hi everyone, we are two real doctors. We are really married and we are going to give you our real reactions to the Pitt. I am Peggy, I'm an emergency medicine doctor, and this is my husband.
James, I'm really James, like really James.
He's an internal medicine doctor, and we are making it through our way through season 1. Season 2 is about to premiere, but my goal is to have us watch at least all of season 1 before season 2 premieres. Who knows? I'm going to try to edit these as quickly as I can, but at least watch them all at the same time beforehand. And if you want to see more of us, you can find us on my social media on TikTok and Instagram under the same name, Pegs for Days. And otherwise, let's go ahead and get started, right?
Hey!
Not now, Myrna.
Oh, women in labor. 10 minutes out.
What are you still doing here?
So he just sent that other guy home, right?
Yeah, the guy that he caught stealing drugs.
Fentanyl, yeah.
It was benzos.
What is
Benzos,
Benzos?
yeah.
Benzos.
I need you to run a pharmacy audit on Langdon for the last 3 days. I need a list of all the patients he's treated and all the medications he's prescribed.
I want to know why.
No, you do not. You sure you're still good to stay?
This doesn't seem like a charge nurse kind of
Yeah,
job.
this is
like
not a charge nurse.
administration. Like the charge nurse has way more real-time things that she has to deal with.
Yeah, well,
Yeah.
I mean, they're limited by the number of characters they're allowed to have.
Right. Uh-oh, what's that?
Okay, that's his pills. They're not his pills?
Maybe those are the pills that he took from Langdon's locker?
Maybe.
Ba siya nakitang ganyan galit na galit? Mas grabe pa sa patay na score. Ay,
0228.
sobra. At least yun nakakatawa. Ito
$20.
O siya, kita tayo mamaya, ha?
Natalie Malone, 35-year-old G3P2, 39-week pregnancy and active labor after a shrunk.
I'm fine.
Oh no, this is the labor episode.
Is it bad?
This is like, I mean, I don't know what happens to it, but like laboring patients are like my worst nightmare. That shit scares me. That is the stuff that truly scares me. So this is gonna be complicated. You know it's gonna be complicated.
Oh, yeah.
So now I'm scared.
What are you gonna guess? Cord wrapped or
I don't know, I'm really scared. I'm really scared.
bleed? Crash C-section?
So I decided to wait it out this time. But then my water broke.
Natalie, you're crowning.
We deliver your baby here.
Call L&D and tell them this baby is coming now.
Yeah, like as soon as that pregnant woman hit the door, we would have already called OB.
Yeah.
Because like you never know, like that baby would have popped out immediately within like seconds of arrival or whatever. So like as soon as the ambulance even knows a pregnant woman that is like at full term is on their ambulance in signs of labor, like OB's even like waiting in the ER before the patient shows up. And like when they're like, let's peek down here, like that is what we do, but we've already called OB at that point because every second cannot be wasted. And then yeah, like that is what we do. Like so from my standpoint, like as my job is to make sure like are they stable enough to be transferred to the OB service, like upstairs on an elevator or whatever. And like if we look down there and there's signs that the baby is imminently delivering, like you can see the baby's head and scalp and hair, then like we can't move the patient upstairs because like the worst case scenario is that they would deliver the baby en route to another part of the hospital.
Yes, terrifying, huh?
But anyway, I'm just saying, like, I'm bracing myself because, like, I've told you this before. Like, my worst nightmare is an OB type of patient with no OB around.
Yeah.
That's like my worst nightmare. So yeah, that stuff is scary.
I've got the prenatal bag, and let me pull up the birthing playlist on my phone.
Fuck Beyonce. Fuck her.
Did you wish you had a birthing playlist?
No, I can't hear anything at that point.
Yeah.
Head is out.
Nice. Take a break. Catch your breath before the next one.
We got this.
What's your
3, 2.
I've seen this before.
What do we have in here?
So far, it's uncomplicated.
Yeah, we're like delivery. Like other people are like, oh my god.
I was gonna say, it's actually pretty good prosthetics.
It's great. It's great.
You know, my back is killing me. 4-hour car ride.
Pain seeker, what are you coming for?
It's a fever.
I tweaked it. I think they gave me morphine, and that worked pretty good.
It's tacky. Hypertensive.
Remember how I said you get good at spotting the fakers? He's exhibiting every sign of opiate withdrawal.
He said he doesn't take drugs. That's exactly what he would want you to believe if he was drug seeking.
There's
head's
OB.
pulling
Oh
back.
my god.
What's the turtle sign?
Turtle sign's like it's coming out, but it goes back in.
And what is that? Shoulder dystocia?
Yeah, the shoulder's stuck. The shoulder's stuck. But like OB should be here already.
ICU boarder, 48-year-old cirrhotic, here for hematomesis.
Intubated overnight and after 1 minute.
She's so yellow. From far away, you can see how highlighted yellow she is. Jaundice. Signs of liver failure.
I'll have you help with the McRoberts maneuver. We're gonna lift your knees up to your chest now.
Great.
Hyperflexion, and then they push down on the pubis to try to push the shoulder
Yeah,
down.
push the shoulder down, yeah.
We're almost there. Keep going. Love you.
Go team Natalie.
Late decel.
Okay, can you call Dr. Ingram and tell him to come down here, please, from the queue?
I'm getting stressed out.
Baby's heart rate has slowed, which could be a sign of distress.
I'm so stressed.
He's only 82 over 46.
Rapid infuser, massive transfusion protocol, octreotide bolus and drip.
Massive transfusion protocol. What's the CVD? Or how much did she lose?
I don't know. A lot? I don't know.
If I can get my hand inside under the baby's head.
Oh my god. Doesn't this make you scared and freaked out?
Yeah.
Like, give me esophageal varices any day.
Yeah, I mean,
But
esophageal varices.
the baby shit scares me.
Yeah.
Yeah, I'm Dr. Myers with
Esophageal
obstetrics.
varices, you
Oh,
can
thank
like do
God,
so
the
much.
OB. Is that the OB?
OR is prepped and ready.
Rotating posterior shoulder. Up and out.
Oh my God.
Good. Hey, we got a baby boy.
Oh no.
Oh no, stillbirth.
No.
Milk, dry, and stimulate.
No,
Vigorously.
that's
Very vigorously.
Shouldn't he be crying by now? Heart rate is 95.
Good.
Too slow. Heart rate is too slow.
Breathe, baby, breathe.
There we go.
That is very good.
Hemorrhagic shock from varices. Oh, best way to stop the bleeding is direct pressure. First balloon goes in the stomach as an anchor. Second runs the length
they
of the
do Blakemore?
esophagus with direct pressure on the...
This one's called a Minnesota. There's different ones
is
with
there?
different names, yeah.
Okay, here we go.
Heart rate's 124, BP still only 84 over 42.
Bleeding is still brisk.
They haven't started infusing anything yet.
Inflate the gastric balloon. Start with 50, and then we'll check the placement of the stomach with an X-ray.
So like placing these tubes is very rare in the ER.
Yeah, super rare.
I've never done it, actually. I think the last time we thought about doing it, because the patient was bleeding out and vomiting blood in front of me, I asked the charge nurse and the team to find one, and they're like, we don't have one.
Yeah, I mean, I've only seen this done once. Not the Minnesota, but a similar tube.
Yeah,
And-
like this is the name of it. Like it's like different brand names or like the whoever made it or whatever. They're slightly different tubes, but they're basically tubes that go down into the stomach to try to tamponade, try to stop the bleeding from the source.
Yeah, exactly. It's like it's the equivalent of like if you cut your arm, like huge cut on your arm, you have to like put pressure and tourniquet it. It's
Yeah.
the same idea, but from the inside. But yeah, I've only seen a true massive transfusion protocol one time, and like a similar tube one time in my
Yeah.
career.
I mean, I would have already called the GI specialist at this point.
Yeah.
The tricky thing with the GI specialist is either the patient is bleeding too much and they're unstable for the GI specialist, or they're not bleeding enough and the GI specialist doesn't think they're sick enough to need the GI specialist to come in.
Yeah.
So that's the tricky part.
And
if
then
it's
they do it
overnight.
tomorrow morning.
Yeah, but the whole point of it is, I see bleeding patients, like vomiting blood, varices patients all the time. Like that is still scary, but not as scary to me as like a delivery complication as the last one, because that is super rare. And we usually always, where I trained and worked, we always had OB very close by, so they would just whisk those off, and that's what they're used to, right? But like what I don't see often and what I don't have to do often is those types of OB complications, so that's why that scares me.
I think it's also like with the GI bleed, there's only or variceal bleed. There's only so much you can do personally.
Right.
You try to transfuse as much as you can. You may put that tube in, you may not, but like at the end of the day, like that's all you can do. Like you can't there is no such thing as rushing them to surgery.
Right. Well, you just keep trying to, like me, keep calling GI, please come, please come.
Yeah, but no, I mean, if they're bleeding that much, GI can't see anything. Like there's literally, they
Yeah.
can't see anything over that much blood.
Yeah.
So you just literally hope, give them all the factors, you give them the platelets, you give them the blood, and then you just hope for the best. Whereas the OB, like you have to do something, and there's like 1,000 ways it can go wrong.
And there's a baby's life and a mother's life at
Right,
stake.
exactly. It's
That's-
double.
That's like really scary, I think.
Yeah.
Because I think I'm used to treating really sick adults and especially liver failure patients and things like that. That's I see countless, don't know how many, but like treating a really sick fetus, unborn child, or pregnant woman is very rare for us. So really scary. But yeah, like, okay, if you told me tomorrow on my shift, place this Blakemore or Minnesota tube or whatever, I'd be like, quickly, let me review that.
Yeah,
because it happens so rarely. It's like I'd have to review it quickly because there's only so many things. Like we have to know a little bit about everything, and it's just like so hard. So there was always a tiny bit of time for me to review it. Like we learned it, but then you're not supposed to. Like we're not totally versed in every single rare procedure, so we always have to be able to just be good at acting on our feet and learning on the spot. Yeah, like I actually have to be good at learning on the spot.
Mm-hmm.
You're a natural.
That must be hard for her to like have a miscarriage and be taking care of a pregnant woman at the same time.
Yeah.
And I'm telling you, this happens all the time. Like lots of female doctors, both in OB, are dealing with their own, miscarriages, fertility issues, and have to take care of pregnant women. Or like this emergency doctor going through a miscarriage herself and having to take care of somebody else while delivering a baby. It's hard to do.
Yeah.
But you just kind of shove everything about yourself down and just don't think about yourself and then take care of who's in front of you.
Yep.
I don't know if that's exactly healthy, but that's how we do it.
As soon as your placenta's out.
Definitely not healthy.
Oh.
Oh no, is she gonna... Oh, here comes the bleed. Oh no. Okay.
Oh wow.
What?
That's a lot of blood.
Yep, I knew it. Lucretia.
This happens sometimes. We have to help the uterus clamp back down. Starting uterine massage, 40 of oxytocin in the back, 800 mics of sublingual misoprostol, and 1,000 of TXA. 2 units from the blood bank, just in case.
It's too smooth.
What's too smooth?
The delivery. Even though the baby was not initially responsive. I was like, there's gonna be some sort of bleed afterwards.
He's been stealing meds. Stop. I don't want to talk about this. I said stop. I don't want any part of this.
She's almost like defending Langdon or protecting him.
I think she just doesn't want any...
Spreading anything?
Yeah.
Oh. Yeah.
I mean, it's messy. It's like...
No, yeah. I mean, I don't want to like spread stuff.
Yeah. I mean, for me, I just feel like, I get it. I'd be like, it's not saying like he's right or wrong. It's just like, I don't want to deal with this. This is not my... You can imagine.
Yeah.
We're going to admit you to the ICU for overnight monitoring.
Thanks, Dr. Robbie. Thank you, Dr. Collins.
Excuse me?
But she got clean the day that she found out she was pregnant with me, and she has been ever since.
Sounds like a good mom.
She's the best. Are you close with your mom?
I'm sure, yeah. Like proximity-wise?
Can I get you anything?
No.
I didn't even know that you were trying.
I really didn't tell anyone.
She said she was doing IVF.
Yeah, no, I heard that, yeah.
I mean, all miscarriages sound hard, but that sounds really hard too. It's like she was actively trying a very medically long road to try to get to where she is and then lost it, so that sucks.
Yeah.
Do you know how much IVF costs? Should have gone into reproductive endocrinology.
That's what we all said.
That's what we all
as soon
said.
as I found out the prices of IVF, I was like, wow.
But just remember, you still have to go through OB residency.
That's what James said. I was like, I could never handle an OBGYN residency, and that's, no.
Pay out of pocket.
I think I would be more likely to do neurosurgery than reproductive endocrinology.
I got pregnant a few years ago. I never told him.
She's talking about a baby with him?
I'm not sure. I'm trying to read between the lines. I can't tell. Could be him, could be some other dude.
Look, Cassie, it's really about what's best for Harrison.
Harrison wants to live with me.
I don't believe that.
That's because at your age, your prefrontal cortex hasn't really even fully formed. I'll be 25 next month.
Oh my God.
That's...
She's 24?
terrifying.
Oh my God.
And if I ever, so help me God, see you in that shirt again,
This is bonus, Mom.
let's just say you will have wished you had
It
him.
was just a few hours ago. I was asking you, why didn't you consult me first? And specifically telling you never to do that again. Using Butte was unconventional, and while it wasn't dangerous, it could be subject for scrutiny, which I really don't need any more of.
Why is he mad at her for giving buprenorphine?
don't know. I really don't know. I mean, I think
Just because she wasn't honest about like treating his withdrawal, is that what it was?
I don't really know. I mean, Bupe is actually a reasonable pain med. I mean, at least isn't becoming more and more common now. Patient quality scores? I have no idea.
I don't know.
Buprenorphine is great.
He's just mad. I guess he was saying, are people not honest anymore? I guess like she wasn't forthcoming about treating opioid withdrawal, I guess.
Yeah. Yeah, I guess so.
I mean, medically, like, I don't think she did anything wrong.
Yeah. No, medically it's very
So
reasonable.
I think like maybe it's more of like an ethical thing, maybe, that he's talking about.
Yeah.
It's a medicine specifically targeted to treat opioid withdrawal.
I return my shopping carts, like I pay my taxes. That sound like a drug addict to you?
Yes, because anybody can be an addict. You are proof of that.
What do you think about that interaction?
It's kind of weird.
Well, I would say it's very, very typical and expected for a patient to be angry when we confront them with like an addiction
Yeah.
kind of problem.
Yeah.
Like if a patient isn't ready to accept it, or is in denial, or is trying to hide it, or for whatever reason, and you confront them and tell them, like, most patients get very angry and demand to leave and will walk out and stuff. That's pretty typical.
Pretty typical.
Yeah. So I just kind of brace myself for those kinds of conversations, and I try to be as non-judgmental, but just stating facts. You know, like, your body is like used to this medication or drug, and your body is going through withdrawals, and this is how you treat it, versus like trying to be less judgmental, because I do believe that addiction is a mental illness, and like
absolutely
a chronic illness for sure. And so anybody can get addicted to any like addictive things. And
yeah, I mean, generally, probably just be more upfront about it. It's kind of weird it's weird to sneak people Suboxone when you're suspecting them to have withdrawals. But yeah.
Yeah, but I guess, I mean, he wasn't honest about using drugs either. So trust me, it's very common for people to not be honest with their doctors.
Yep.
We're very used to it. We're very used to finding out information later that the patient denied or did not like volunteer. And so we're not surprised, and it's just kind of human nature. And we understand, like, we have to like work in we work in an environment where people are either like in pain or in shame or hiding things or whatever, right? So I feel like being in emergency medicine, or medicine in general, like, you just like, there's a lot of like, as is dealing with all people in any kind of like in career or something, you just have to deal with people and all types of like human emotions and like all that stuff.
You must have dropped them. Gotta be more careful. You don't want these ending up in the wrong hands.
You can keep them.
You ever think about quitting?
I'm not a quitter.
One day, when your liver fails, and believe me, it will fail, you won't be so happy. It's not a nice way to go.
I'm digging my own grave. Let me.
He's the alcoholic frequent flyer patient.
So what kind of pills do you have?
Those are benzos. It was like Librium or something like that. It was the meds that Ellington stole from him. That's why he's like, are you gonna stop? He's like, I'm not a quitter. Like, I'm not gonna stop drinking.
I say Colin's home.
You don't want to work with anybody today. You must be in a mood.
She's had a rough day.
Everyone's had a rough day.
I'm punched, kicked, spit at, pissed on, and feces thrown at me. People are angry, our tempers are shorter, and we're still just trying to help.
You do help. You do make a difference. One asshole doesn't get to change that.
I think I'm done.
She's retiring?
I don't know if she's retiring, but she's just like, I'm done with this. So yes, or quitting, I don't know, whatever you want to call it. After like during 2020, the pandemic, there was like all of that like love for healthcare workers and frontline workers, and everyone's like, at 7 p.m. at night, everyone's doing the clapping and the cheering. Like that was like so nice, because that's never happened before. And let's just say it went back to how it is.
Oh yeah.
Yeah. Like, it was temporary.
That's how things always are.
Yeah, it was. Yeah, but like, I would say like I've heard from other nurses and doctors and stuff, like the burnout after going through the pandemic and sticking through it, and then like having things not get any much better or something like that. Like, a lot of people have quit medicine since then too, kind of in relation to it, because like, you know, just the burnout, just feeling not valued, or, you know, overworked, and a lot of other issues, kind of like what she was talking about.
Yeah, you can dedicate a whole episode just for that.
Yeah. Code triage. Multiple GSWs. There's an active shooter at Pitt Fest.
Oh no, that's where his son is.
Jake and his girlfriend are there.
Oh no, his stepson and his girlfriend are there. Oh, this is the end of the episode. So code triage, it sounds like that's like a mass casualty event.
Yeah.
An active shooter, multiple injured people. Sad to say that is actually not that rare anymore.
No, that
in our
happens
country
frequently.
to have like mass casualty events. I mean, sometimes it's not just from like active shooters. Like sometimes it could be from like
emergencies.
Yeah, like sometimes if there was like a
fires,
natural disaster, yeah, or like a big bus that got hit by something and there's multiple people. So we have like mass casualty protocols in place, and we like talk about it, maybe try to practice it when you can. So that does happen. Less scared of mass casualty events for me than a pregnant patient with a delivery complication. Delivery complication is still scarier to me. Yeah,
it's pretty funny.
It is scarier to me. But anyway, I mean that just means that they have to prepare all hands on deck, and there's going to be a massive influx of patients, and they are understaffed already.
Yeah.
It's going to be bad. And of course, it happens at change of shift.
Yeah, less than an hour left of the shift.
That's what always happens. Is like, I barely have my head above water. I'm like, I'm keeping up my pace. My shift is over. It's over. There's a light at the end of the tunnel. And then it just is like this huge tsunami hits me at the very end of my shift. And then I don't get out of work on time. As is the story of my life. Yeah. All right, what do you think of this episode so far?
Pretty good.
What do you think
One of the lighter ones.
Lighter ones?
Shockingly. Compared
no
to
one
like,
died?
yeah, because no one died yet.
No one died yet. I mean, like, I guess I wanted to say, so like the whole delivery complication with the upper GI bleeder with esophageal varices, and like they fixed both of them, saved both lives, and they just kind of moved on. I was like, now like when I think about it, it's like we're so used to that's like what we do, but we don't realize like they literally just saved 3 people's lives if you count the baby, right? They just saved 3 people's lives and they just move on with their life. And like I actually like started telling residents and trying to tell myself like, hey, you just did an amazing thing. And like to try to like, because we beat ourselves up about all of the things we mess up on and all of the losses and things like that. And we take those so heavily, which is, I understand that, that's a big deal. But we also need to realize that like we're really good at what we do. And when emergency medicine, that's the pinnacle of emergency medicine, right? That's the point of why we do it, is to like save those lives in those critical moments. And it happens like multiple times a day, and then we're just so used to it, we just like forget, we just like move on to the next thing because that's just what we're used to. But literally just saved a life, just prevented all these people from dying. They were on the brink of coding and dying, and we're like, okay, yeah, admit, next one, so I just try to like tell myself like, hey, like I made a difference, or like, hey, to the residents, because it's a huge deal.
Yeah.
I think we need more of that, less beating ourselves up and only focusing on the losses, but also recognizing like when we do things right.
Perfect is the enemy of good.
Wait, what is that? Perfect is the enemy of good doesn't have anything to do with that.
That means you can't
You're
win
saying,
everything.
You're like perfect is the enemy of good.
Can't save everybody, but if you like save like 90%, that's really, really good.
Oh God, okay, so I'm sorry. The backstory is James really likes this perfect is the enemy of good phrase, and I don't think medicine is a perfect.
It's not a phrase, it's a way of life.
It's a way of life. It's James's Hakuna Matata is perfect is the enemy of good, and basically he's just like good enough is good enough, essentially.
No. It means that you can't expect to be perfect. No one's perfect.
Yes.
And that if you're always focused on perfection, you're gonna miss out on a lot of important things. That's it.
Yes, but when you use it with me, you're like, I'm like trying to make a decision, like booking something or like whatever, designing something or writing something card. You're like, perfect is the enemy of good. You're like, good enough is good enough.
Yeah, depending on the context.
That sounds like I wouldn't use that in medicine.
It means something different in medicine.
In medicine, okay. We just finished episode 11. That means episode 12 is next.
Yeah.